What happens when the healer becomes the patient? It's a strange thing. To be trained in the art of calming minds, yet find your own spiraling. To know the theory, the neurology, the treatments, and still feel helpless when anxiety tightens its grip around your chest. Psychiatrists, psychologists, mental health professionals, they're not immune. In fact, sometimes their knowledge makes the experience even harder, because they know exactly what's happening and they still can't stop it. Imagine standing in front of a mirror, not just seeing your reflection, but everything behind it. The training, the patience, the books, the expectations, and then the very human truth beneath it all. You anxious, vulnerable, just like the people you've promised to help. That's the paradox. The psychiatrist's paradox. We often like to believe that knowledge protects us, that credentials build armor. But anxiety doesn't ask for your degrees. It doesn't care how many people you've helped. It shows up anyway, quietly sometimes, or loudly, all at once. And when it does, what do the experts do? Well, not what you might think. They don't rush for the pills. In fact, many of them resist medication for themselves, not out of arrogance, but humility. They understand the power of those tools, and they also know their limits, the side effects, the risk of masking something that needs to be heard, not silenced. So instead, they turn to the quieter tools: breath, routine, space. They take a moment to name what's happening, not with judgment, but with precision. This is anxiety. This is tension in the body. This is a thought, not a truth. In the clinical world, there's a practice called cognitive diffusion. It means stepping back from your thoughts, seeing them not as commands or facts, but as passing clouds. A psychiatrist might say to themselves, "I'm having the thought that I'm failing," and that one extra layer of awareness, "I'm having the thought," can be enough to loosen the knot. But this isn't abstract. It's lived. A psychiatrist in the middle of a panic attack doesn't recite textbook entries. They go to their rituals, the simple ones, the grounding ones, pressing their feet into the floor, naming 5 things they can see, slowing their exhale, not fixing, just containing, because that's something they understand better than most. Not every emotion is a problem to solve. Some emotions just need a place to exist. You might think that would be frustrating, to feel anxiety and not try to eliminate it. But what if that's exactly the point? What if true mastery isn't about elimination, but endurance? Here's the deeper truth. Many psychiatrists view their own anxiety not as failure, but as a kind of teacher, a mirror they don't always want, but often need. They've sat across from countless patients, each one describing their private battles. But when the tables turn, when it's their own chest tightening, their own thoughts racing, they remember what it feels like to be on the other side. And that makes them better, because it softens them. It adds weight to their empathy. Suddenly, it's not just theory, it's lived experience. The healer becomes more human, and in doing so, more helpful. But that transformation only happens if they're willing to drop the mask. To admit they're not just a role, not just the expert in the room. They're also a person, with their own shadows, their own breaking points. That's not weakness, that's integrity. In fact, some psychiatrists choose to be radically transparent with their colleagues, and sometimes even with their patients. They might not go into details, but they don't pretend to be untouched, because pretending helps no one. Honesty, though, that builds trust. It opens a door, not just for them, but for you too. Because if the people who are supposed to have it all together can say, "I'm struggling," then maybe you don't need to be perfect either. And isn't that a kind of relief? There's something else you can learn from them, something you can apply, even if you've never studied a day of psychology. It's the way they name things. Psychiatrists are careful with language. They know the difference between panic and discomfort, between disorder and emotion, and that precision matters. You can practice that too. When you feel overwhelmed, don't rush to label it as brokenness. Ask yourself, is this fear or anticipation? Is this anxiety or responsibility pressing at the edges? Is this unbearable or simply unfamiliar? Sometimes the naming is the healing. Other times, there is no clarity, only chaos. And in those moments, psychiatrists don't always try to fix themselves. Instead, they create containers, safe spaces to let the emotion breathe without flooding everything. A walk, a page in a notebook, a conversation with someone who won't try to rescue, just to listen. Containment over correction. And here's something they know well. Anxiety isn't a sentence. It's a signal. It points to something. A value, a pressure, a conflict inside that hasn't been resolved. Even for the most composed people, anxiety is often the mind saying, something needs attention. Not punishment, not judgment, just a tension. So maybe, if you're feeling it, that rising tide, that weight in your chest, maybe it's not something to escape. Maybe it's something to explore. Because even the experts sit with it. Even the most trusted, respected, credentialed minds get lost sometimes, but they also come back. They come back with new language, with new grace, with a deeper understanding of what it means to suffer and still show up for others. And that perhaps is the real definition of professionalism. Not being unshakable, but learning how to live wisely within the shaking. You don't need to be a psychiatrist to understand this. You just need to be willing to look at your anxiety not as your enemy, but as a messenger. To stop asking, how do I make this go away? And start asking, what is this trying to tell me? You're allowed to pause. You're allowed to not have all the answers. And still, you're allowed to keep going, just like they do. Because healing isn't about escaping discomfort. It's about walking with it, gently, and still finding your way home.